Today. I hope you're all staying well given the current circumstance. So I'm excited to share some ongoing work that I've been doing with my collaborator, Colin West at the University at UCLA, looking at kind of extending some of my dissertation research and looking at how providing aid in the form of saving time might be particularly beneficial, particularly among those who are both financially constrained and temporally constrained, that is the working poor women. Again, this paper was actually accepted as a pre-registered report, but so it was accepted at Nature Human Behavior before the results are known. So we're kind of collecting, we just did our last round of data collection. And are going to be kind of putting together the data set. So you're getting some interim results here. And I'm happy to answer and address any questions toward the end of the talk actually about that process, because I know it's something that's unique. And it definitely changed our study design a bit. So it's something that I know can be an interesting point of conversation. So you're going to see some interim results here, but I'm also just more happy to talk broadly about kind of what the process was like of getting a paper accepted before you have any results whatsoever, which is definitely an interesting adventure. So most of my research, as Samantha was pointing out, focuses on time, money, and happiness. I have quite a lot of data suggesting that when people give up their financial resources in order to save themselves time, such as by choosing to work fewer hours, to have more time off, choosing careers that afford more temporal flexibility, or spending money with the deliberate intention to save time, that this can have positive downstream consequences for subjective well-being, stress, and even relationship satisfaction. In another paper that we're currently revising, I find that couples who make time-saving purchases together are just as happy as couples who are good listeners. So it seems like what we do with our financial resources can play a powerful role in our subjective well-being. But what happens when you try to take this and understand the policy implications, right? So obviously we found in my initial data that people who are living at or below the poverty line were those who benefited most from making time-saving purchases, because they're not only pressed for time, but also not only pressed for cash rather, but also pressed for time. So we wanted to look at whether aid designed to save time might be particularly effective among those who are struggling to make ends meet, given that they're most likely to be both time poor and cash poor. So this project really kind of is looking at that direct question that came out of my dissertation. So we know that people who are living kind of at or below the poverty line, that just being poor and even the feeling of not psychologically having enough, and this is maybe something relevant and more relevant now than ever before with unemployment rates going up as a result of the current crisis that we're facing. But people who feel financially poor and are financially constrained and just feel generally like they don't have enough are less likely to engage in preventative health care even when access is available. They're also less likely to adhere to their medication. They are less productive at work, and they are less likely to adopt useful new technologies even when they're cheaper than what they're currently using and could yield positive outcomes in areas that are important, such as farming and other kinds of production tasks. So, kind of what explains these pervasive effects? Well, we also know from the psychological literature that poverty is linked to lower well-being and greater stress and can impede cognitive function. So there's been some research, some of this replicates, some of it, there's been a little bit less replication on some of these effects, but the basic pattern is that feeling like you don't have enough leads to myopic thinking. This leads to this feeling of scarcity that makes you focus in the present moment, in the here and now, and can be associated with lower well-being and greater stress. We also know that poverty involves a shortage of time. So when people engage, we kind of classify people who are time poor as individuals who have to engage in long hours of unpaid work and have no choice but to do so. Time poverty is a kind of tax that severely affects low-income women and working mothers living in developing countries. So I'm kind of setting up the kind of general framing and context of the field experiment I'm going to present. So why we decided to run a field experiment among a working population sample of women living in a developing country context is because these women are most especially likely to be time poor. So women, for example, in sub-Saharan Africa, where we did the field experiment that I'll talk through in a second, spend an average of 4.2 hours on unpaid work each day. And it's interesting because a lot of aid organizations and policymakers, and just even for ourselves, we have bias around, like, we think we're going to have more time tomorrow than we do right now. So people who are The assumption in a lot of the models of how to help people who are struggling to make ends meet is to give them financial resources. And this is based on a working assumption that people who are cash poor are time rich. So there's been quite a few examples in the literature of aid programs actually neglecting time costs placed in recipients, or are trying to actually increase the amount of friction, increase how difficult it is to get aid under this assumption that people who are poor will have more time or work harder to go get that aid. So for example, in the development economics literature, there's a huge body of research looking at self-targeting. So many aid programs will build in ordeal costs to target low-income households. It's not always effective, and if anything, it can reduce the uptake of aid. So people who are most likely to need it are the ones that are least likely to get it in certain contexts. So, this is part of my broader program of research, trying to understand why we sort of discount our own and others' time. So I even know, like, working adult samples that I've collected in other contexts, we find a great deal of evidence that we're not very good at thinking that we're going to be time poor in the future. So we even discount the value of our own time, whereas the value of $100, of $500 is sort of invariant across time. We think that $500 is going to be equally valuable to us now as it is in 1 month, 3 months, 6 months. When it comes to the value of an equivalent amount of time, or a 1 week, 2 week vacation, we're kind of like less likely to know what to do with that. We kind of heavily discount the value of our future time. So this is also seeming to bear out in the context of the way that we think about giving aid to people who could benefit most. So time neglect might occur because policymakers often focus on material constraints, and this comes out of like a historical focus of thinking about improving the welfare of society based on increasing GDP. Obviously, we're moving away from that now with more and more countries recognizing the importance of immaterial things like trust in government and safety and less air pollution. So there's definitely been a shift in the policy space away from just focusing on increasing welfare of citizens by increasing wealth. But there is a strong historical precedent to focus on making people's lives better by providing them with material goods. There's also this belief, implicit and explicit, that people who are poor have a lot of idle time. This is kind of goes with some negative assumptions and negative implicit bias that we have around people who are poor, that because people engage in system justifying beliefs and that they want to believe that that couldn't happen to them, they sort of try to make it internal attributions for why people don't have enough, as it's something to do with them, that poor people are lazy and don't work as hard as people who have more. These kinds of beliefs are especially pervasive under high levels of income inequality. So the more that wealthier people have, the further that they have to fall, the more likely at specific times that they're likely to hold these system justifying beliefs. And so that could also impact the way that we think about distributing aid, such that there's a belief that the materially poor have a lot of idle time, when in fact, as I mentioned, my survey data suggests that's not the case. If anything, it's the opposite. And then there's just in general, what I was saying off the top of this slide is that there is a psychological bias to undervalue time. So this is true, we undervalue our own time, and we're policymakers trying to think about how best to help those in need. We're probably likely to undervalue the value of time for these individuals as well. And in general, one thing that we might kind of gravitate toward helping people, providing cash or material goods to individuals who are struggling to make ends meet, is just because we don't know how busy they are. We're not really sure what people would do with the free time if we were to give them additional time. So there's a lack of time use data among the working poor, and some of this data collection that we've been doing is really just to get a descriptive sense of how do people who are struggling to make ends meet in developing country contexts spend their time, and how are these different sources of time use associated with well-being. Of course, right now, given the COVID context and how unemployment is rampant, in particular, not only in the US, but in developing country contexts, I think it's really interesting to think about whether the assumptions of the models and of the studies that I'm collecting now hold. So I also have a colleague at HBS, Reshma Hussam, who is a development economist, and she's been looking at the impact of forced idleness on well-being. So I think it's interesting to think about when, and not only whether, time-saving aid might promote well-being and reduce stress among the working poor, but also when providing meaningful work, like kind of when these forms of aid might be most effective. And I actually get into that in the talk a little bit, as you'll see later. So we wanted to kind of test our assumption of whether policymakers are likely to kind of discount time as a viable route to improving welfare among poor working women. So we asked policymakers who were studying at the Harvard Kennedy School to imagine that they were consulting for a nonprofit aimed at increasing the well-being of working mothers in Kibera, which is the informal settlement where we collected these data. And we asked them how they would allocate 2,100 shillings per recipient, and we gave them 3 program choices, commonly given aid programs: cash, in-kind, and time. 2 people spontaneously suggested that they would use this aid to save time, and 87% chose cash. So we do see this strong bias toward material goods in this hypothetical context that maps to some of my earlier research, where people are also likely to discount the value of time saving for themselves. So we know that poverty involves a shortage of time, so reducing time poverty instead, might be another way of reducing some of these cognitive burdens of poverty that could be caused by not having enough time. And so we were really interested in understanding. We know that reducing material constraints, providing unconditional cash transfers can have a powerful effect for subjective well-being and reducing stress. Johannes Haushofer and his colleagues at Princeton and in other places have a lot of really great data on that. But we wanted to take a slightly different approach and ask whether the data that I have from some of my North American samples, where giving people money to spend to save time reduces stress and increases happiness, might also be effective for reducing stress, relationship conflict, increasing cognitive function, and even potentially leading to economic mobility among working poor samples. Now, there could be just like both giving cash and giving time lead to these downstream positive consequences. Just getting something that solves a pressing challenge to the extent that people in the sample are feeling time poor and materially constrained could be useful. We thought that giving time might be particularly beneficial to the extent that people could capitalize on the free time that we gave them by doing things they wouldn't normally do. So while as a cash transfer might go to paying bills, it doesn't necessarily free up women's time to taking an educational program that they might not have otherwise done. We don't have all the data back for some of these secondary analysis, but we did think that there were specific dimensions by which time might actually perform better than an equivalent unconditional cash transfer. There's also indirect evidence in the development economics literature suggesting that time-saving services can have health benefits for working women living in developing countries. So there's been some great research looking at the downstream impacts of providing cook stoves. So they're in this Indian development survey of over 40,000 households. Women who had access to electric cook stoves didn't have to go fetch wood, saved them time, and also obviously was less bad for their health in terms of the smoke and emissions, were significantly healthier than women who did not, and significantly healthier and less stressed than women who did not have access to these cook stoves. But of course, this was a correlational study, so we can't actually rule out that just wealthier households were more likely to have electric cook stoves, and as a result, were also just healthier. So there could have been other confounds here, which is why it's really important to understand causality in this context. And as I mentioned before, I also have indirect evidence that time saving can produce benefits for well-being and reduce stress. So in an experimental study and in some subsequent follow-up work I've done since, we see that when we give working adult samples who are busy working adults, money, and we give them the explicit instruction to spend this money in a way that saves them time versus to spend this money on a material purchase for themselves, that spending money in a way that gives them more free time, significantly reduces stress and improves well-being. We've also shown similar effects, as I mentioned off the top of the presentation, for relationship satisfaction. So this brings us to this current context. So overall, we know that people who are living at or below the poverty line experience a lot of stress in their lives. They are financially constrained, they're also temporally constrained, and working mothers living in developing country contexts who are struggling to make ends meet might be the most likely to benefit from time-saving services, given that they often lack the infrastructure that we take for granted, like laundry machines and fast food. So we wanted to look at whether time-saving vouchers could have unique predictive benefits as compared to unconditional cash transfers, which are thought to be the gold standard of economic development in terms of aid. So as I mentioned, we were working in an informal settlement in Kibera in Kenya. So it's the largest informal settlement in East Africa. It kind of ranges, like obviously the census data is very hard to get. This is a very transient population. So it's somewhere around 1 million, but it really varies. And I don't know what the current population statistics are, but it is the largest informal settlement in this area. And working mothers in Kibera face significant material and temporal constraints. So we wanted to focus on a sample where we thought time saving could have the strongest, like the best potential of having significant benefits for the population we were trying to work with. So women in this sample worked about 42 hours in paid work per week. Again, this is all pre-COVID, and I think there's an interesting discussion to be had about what parts of our assumptions and what part of our models are going to hold if individuals are unemployed. And we can have an offline discussion about that later. They also do about 36 hours of unpaid work per week. And they make about, 100 to 200 shillings per day, which is, about $1 to $2 US. So they're extremely financially constrained. They're also very time poor. And again, this is what I was just saying, is women in this sample many of them would hand wash their laundry and then have to watch it dry so it didn't get stolen. They also often travel by foot to their places of employment again, and they might work in multiple locations around the city. And so again, you can think that they're extremely time poor as a result of having multiple jobs, taking care of kids, and having chores take a lot more time. And we're in other survey data of working poor from other countries, we're seeing similar effects. So this is just a picture from our pilot field data collection, where this, we're looking for like, how do women spend time? And we do see that they spend about 10 to 12 hours a week on laundry, for example, because this mother is hand washing the laundry. It's interesting to note that there are time-saving services available. So one thing we're really worried about when we started this project is, are we just like importing North American ideas into a context where this just doesn't make sense and isn't what people want? And, as someone who's never worked in a developing country context before, but, through college and our friends at Busara had the opportunity to test this in an important question that I conducted in US and Canadian samples, but never kind of put to the test in a real world policy relevant context. This is a really important question to ask yourself. Is this relevant? Is this question relevant? Or am I just bringing my ideas from my research into a context where this isn't relevant or useful? But as it turns out, we did a lot of pilot work. So this project's been going on for about 3 years. And in the first year, so my first faculty year, I had my new job for 2 days, and then I went on a plane to Kenya with Colin to spend 3 weeks. So I spent my first faculty month in Kibera trying to understand the context, understand if these kinds of trade-offs, if time saving is something they would be interested in and make sense in the context. So there's low supply and willingness to pay. So there are very few affordable services. And even among the services that are available, about 77% of people in our pilots said they never paid for laundry, and 82% never paid for meals. And 600 shillings, which actually in retrospect is about like 3 days labor. So it's not anything to, this is quite actually a high amount. It was the maximum willingness to pay, though, for goods that were valued at 1,000 shillings. So there's just some actual constraints. But I will note that in our pilot data, women did, especially entrepreneurial women, they did pay to outsource. So there is demand among this population. It's just that they lack financial constraints. So it's very interesting to think, like, we were observing entrepreneurs, women who ran small vegetable stands, were paying people to run errands on their behalf so they could stay and sell at their stores for longer. So there was instances of time-saving services happening in this context, and there was a demand. It's just that people here are financially constrained. So, we were surprised to see that people were actually trading some of their limited financial resources to save themselves time, suggesting again that if, considering how poor many of these women are, that even they're spending some of their limited resources to save themselves time is pretty impressive. So in our experimental design, again, as I mentioned, we really wanted to test the efficacy of time-saving vouchers against unconditional cash transfers. So we recruited a sample of about 1,600 employed mothers living in Kibera, and they were randomly assigned to receive the following for 3 weeks during our study. So there's a peer control condition. They received nothing except some small compensation payments for the surveys that we asked them to complete throughout the study. And then we had an unconditional cash transfer study, which our study arm, which again, is because unconditional cash transfers are thought to be the gold standard of aid. And this is because people presumably can spend it on anything that they want to. And so they'll spend it in a way that has the most utility for them. That's sort of like the working assumption of why unconditional cash transfers are so great. And then we wanted to look at time-saving vouchers. Now, one thing we also were really interested in is it's possible that unconditional cash transfers, so there's some mixed evidence in the literature when you give unconditional cash transfers to women, that actually it doesn't completely pass through to the woman, right? So it's going to other members of the household. And so I think one interesting possible difference we were maybe expecting is that because time-saving vouchers, which you'll see in a moment, are actually helping women directly because they're targeting behaviors that only the female in the household engages in. In this context, it's fairly patriarchal. Women are doing more of the chores, more of the housework than men. That we thought maybe part of the benefit might be driven by the fact that time saving is just more likely to directly benefit the recipient, in this case, the woman, as opposed to diffuse through the social network or the household network. So in our control condition, women received nothing at all, completed all of our study measures. In the unconditional cash transfer condition, they received about $5 US or 500 shillings. Again, a couple of days paid labor at least once a week for 3 weeks via M-Pesa. So M-Pesa is a mobile transfer technology. So, it's like getting Venmo basically. And they use all of mobile technology is really, I think 98% of Kenyans have mobile transfer, have M-Pesa and are able to pay via their cell phones. So that's something that we leverage, technology we leverage in the study. And mobile infiltration is really high in the sample, which makes data collection somewhat easier and some of our outcomes and connecting with participants easier. Then we had a time-saving voucher condition, and so we gave women vouchers for time-saving services that we developed through intensive piloting. And again, I've already mentioned this, but unconditional cash transfers have benefits for subjective well-being, engagement with paid labor, increased earnings, empowerment, and it has low overhead due to M-Pesa. So that's why we chose it as our control. So our time-saving vouchers were either laundry or prepared meals. So we gave women we randomly assigned women to condition, and we did pick these time-saving vouchers based on extensive piloting. We wanted to remove the burden of unpaid labor for working women in this sample without having unintended negative externalities. So we wanted to reduce chores that were generally unenjoyable and that weren't also removing something that people find positive, like social time. So for example, in our initial piloting, we saw that women on a weekly basis would have to take things to the dump. They were throwing out things, rubbish or, exchanging some scraps that they found for some extra money. And they reported that as a very disliked chore that was quite unsafe also and took a lot of time. But they also reported it as a highly social event. They would go in groups, they would go together. And we really didn't, after some deliberation, we chose not to include that, for example, as part of an option for time saving because we didn't want to eliminate something that had kind of these high social benefits where women might be bonding with each other or getting important information from each other. So we chose laundry and meals because they saved a significant amount of time for women in the sample. Laundry, of course, more than meals, although you'll see we don't have between condition differences in our interim results. And they weren't associated with other benefits like socializing. We matched on the cost to administer from kind of a policy perspective. So again, thinking about the hypothetical situation I mentioned at the top of the talk, where we asked policymakers if you had a set amount of money, which kind of aid would you give out? We went back and forth on this, but eventually we matched on the cost to administer. So if you had a certain set amount of aid, how should you give it to have the greatest downstream implications for your sample? We were considering doing some kind of willingness to pay auction so that we could make equivalent the objective amount of cash with the subjective value of the time-saving voucher to the participant, to every participant, and then randomly assign them to get the equivalent amount of value of the time saving versus cash. But we decided to go against this because of the fact that people heavily discount the value of time. So we thought then that we wouldn't be actually giving enough cash or enough time to be useful. So of course, I'm happy to have offline conversations, but we did think a lot about this design, and some of it got pushed around in our pre-registered report discussion, like our pre-registered report peer review process. So I'm happy to talk offline. Now our implementation partner was Kibera Town Center, which is a nonprofit that's located right in Kibera, so right at the front entrance of that informal settlement I showed you earlier. So they built this center, actually the actor who was Wonder Woman's mom in those movies, Connie Nelson, is also a major philanthropist, and she built this center under a working assumption that we had, which is we should think about how to help people in this community have access to things that are convenient. So they actually have a laundromat inside. I think it's on the next photo, yeah. So they have like a cafeteria here, which you can't quite see in this picture. They have laundry machines here. And then they have access to, entrepreneurial classes and so on. And that's the data we're still waiting to get back. So that we partnered with them. At first, we weren't sure how we were going to give out the laundry and meals. We were even contemplating starting our own small business because we weren't exactly sure how we were going to, we were going to make a laundromat and a restaurant to try to implement our time-saving vouchers. But luckily, we were able to work with Kibera Town Center, already had these services available. So yeah, this is just a better picture. So they have a clean water facility as well, water filters, laundry. And then the Human Needs Project is what the nonprofit is called. So our full experimental design, we had baseline measures of our key dependent measures of interest, well-being, relationship satisfaction, perceived stress. And then we randomly assigned our participants to conditions. So we had a time-saving condition, and an unconditional cash transfer condition, and a control. So we also, on an exploratory basis, wanted to know, so we're not sure from my past work if the benefits of time saving come from removing a negative experience, like getting rid of a chore you don't like, versus the planning of doing something better with free time that you've saved yourself. So is the benefit of time saving vouchers or time saving services broadly from reducing a negative or adding a positive? And so these two conditions allowed us to understand whether just giving meals and laundry without any mention of the time saving element, so really focusing on removing the negative, would have these positive consequences, or whether both removing a negative, so providing meals or laundry, and asking our participants to very clearly plan what they were going to do with their free time, so spending their time in more deliberate, enjoyable, productive ways, might be kind of the key. So we actually, on an exploratory basis, had 2 time-saving conditions. And then in week 6, we had end-line measures of subjective well-being, reduced stress, and some of these self-investment behaviors like enrollment in educational classes, which we're still going to get data back from. And then we're doing some long-term follow-ups now, which I don't have the data for as well. So we had 3 pre-registered predictions as part of our pre-registered report. So we thought that time saving as compared to cash might uniquely predict increases in subjective well-being. So that's overall cognitive evaluation of how well you're doing in life. So this subjective well-being, increased positive affect and decreased negative affect. So that's the affective component of subjective well-being, which, so I'm usually looking at both the cognitive and affective components. So how well I think I'm doing overall in my life and how much joy, stress I experience on an everyday basis. We also thought that time saving would be better than cash at reducing stress, and relationship conflict would also go down. Again, cash transfers can sometimes cause increased relationship satisfaction when given to the woman, to the extent that they cause fighting between the partners. There's mixed evidence, and the latest research sort of suggests maybe those effects on conflict aren't as reliable, and that actually cash transfers are uniformly kind of positive for relationships. But we were going with some literature that was available to us at the time. So our prediction was that time would beat cash and both would beat the control condition. Now, again, this is a hypothesis that's never been tested in the literature to our understanding in this specific way. And so you know, we made an argument because our pre-registered report demanded us to make a strong argument that time would be cash, but we are actually kind of, to the extent that time and cash are both giving someone that needs both time and cash something, we weren't completely sure kind of which intervention would be the most effective, but we did pre-register analyses. Just want to see how I'm doing for time. Okay, I'll speed things up a little. So we pre-register analyses using a Bayesian approach, and this is based on interim data. We're also interested in individual differences in the ability for women to capitalize on the free time that was available to them. So we thought maybe small business owners, people with higher levels of education, and therefore people who had greater opportunity to work might benefit most from time saving because they could more readily translate that free time that they weren't spending doing laundry into employed work to solve that financial constraint. We also were interested in whether people spent in the time-saving conditions spent less time on unpaid labor and more time on positive activities, and whether this might account for some of the subjective well-being of the time-saving condition more specifically. And we were also interested in modeling out negative spillovers, so time spent doing others unpaid labor, decreased quality of relationships with friends if their friends started to become jealous of the aid that they were receiving, that the participant was receiving and they were not. So we had eligibility criteria, working mothers who were eligible to participate if they lived within a 30-minute walking distance from that center I just showed you. We didn't want people to live further away because then we would actually be causing a burden in the time-saving conditions. So we did think a lot about who should be eligible and why and what the limits of generalizability were. They had to be at least 18 years of age or older, work for pay at least 25 hours a week, have at least one child living at home and enrolled in school. And this was because it's a highly transient sample. And so if a working mother has a kid in school, they're more likely to stick around for the full entirety of our study. They also had to spend at least 3 hours cooking and doing laundry each week and have less than 7 members living in their household to ensure that the meal services that we provided would feed their whole household at least one meal. So baseline demographics, we see kind of a median age of 38, about 32 hours of paid work, 35 hours of unpaid work. You know, about 60% were married. There's quite a high percentage who are widowed in the sample, just speaking to the chronic stress nature of this population. We see kind of less than a majority of women who manage the household, quite high rates of depression, not very many assets, and you know, fairly, you know, they're a little bit probably wealthier than we would expect if we were just to take a random sample given our inclusion criteria, but still, you know, on the definitely fitting with this poor working sample that we would expect. There was some baseline differences in dropouts. So there was no differences between who we retained and who dropped out, but we did have about 7% attrition of people we didn't have inline data for. Many of those moved away of Cabrera, as again, I mentioned, it's a highly variable, highly transient population. And our interim analysis are based on a randomly assigned subset as follows. So we have about 200 in each of our key conditions, and I've collapsed across the time-saving conditions just for the sake of simplicity, since I didn't see differences between them, and I'll present the results quickly showing both with and without. It's noted that the manipulation checks were successful, so we asked people like, to what extent was your burden of unpaid labor reduced? And we do see that people in the time-saving conditions said they had less unpaid labor as compared to the cash or control. Obviously, that's important. And we have some evidence for differential attrition across our conditions, such that attrition was higher in the control condition as compared to the time-saving or unconditional cash transfers, but didn't differ demographically in terms of dropouts, just that when we weren't paying people as much, they were less likely to come back. So that kind of makes sense. So these are condition differences at time 2 adjusted for time 1. So an N of about 600 people here. So we saw, if anything, the time-saving conditions actually seem to decrease subjective well-being somewhat. So these are all non-significant results so far, but we do see a significant or a marginally significant drop in subjective well-being among individuals in a time-saving condition, and I'll unpack that in a second. So we're looking at subjective well-being, stress, and conflict. Subjective well-being is in like this yellowish orangish color. Stress is in the gray color, and conflict is in this red color. So we see no differences in relationship conflict on net across our study. We see really no difference in stress across our study, across conditions. This is time 2, again, adjusted for time 1. And then we see a slight decrement in subjective well-being in our time saving. And I'll unpack that in a second. There was no other between condition differences at endline, and it didn't actually depend on the time-saving voucher administered, so it didn't matter if people got laundry or meals. We also didn't really see much difference in terms of our time-saving planning, where people were thinking about the specific things they would do with that free time, as opposed to just a time-saving condition where we gave women meals and laundry, but didn't ask them to think about what they wanted to do with that time. But if anything, we saw a slightly more negative effect of the planning condition. And again, it's interesting in that, and some of the time use patterns bear this out, but it seems that for some women, they felt sort of that they weren't able to do all the things that they wanted to do with that free time. So the planning actually backfired in the sense that, at least for some women in the sample, it reduced optimism. So they're feeling like, well, I want to do these things, but actually I really can't do them given some of the constraints in my life. And so if anything, asking women in the sample to ruminate on the things that, or like to think about the things that they would want to do with their free time might have led to some rumination. So we're still unpacking these findings a bit. So you can see, again, speaking to this optimism point, you have a slight reduction in optimism in the planning condition, again, kind of speaking to the point that I just made, that really thinking about what one would do with their free time for women in the sample might actually backfire, at least for some individuals. So there's no significant differences by time saving, and the trend suggests that planning undermined well-being and optimism, and if anything, increased conflict. So we then wanted to look at individual differences in time capitalization. So we found that education level did not shape the benefits, and neither did entrepreneurship. But we did see initial evidence that the relationship satisfaction benefits were strongest for women who are experiencing higher levels of stress at time 1. So for women who are experiencing higher levels of stress at time 1, just to orient the graph, you see time 1 well-being on the X, and a relationship satisfaction or relationship satisfaction at time 2 on the Y-axis. And you can kind of see here, I think, so the red line is the time saving in this condition. So you see this kind of flattening, but for women who were experiencing more stress, I think this is conflict, sorry. I would just want to go to these results here. Yeah, so you see somewhat, so those results aren't actually that clear, but it's not that big of a deal. We basically find some effect of time 1 stress, such that time saving, sorry, I'm just gonna go back. Time saving buffered against the negative effects of stress. I don't think the graph is as clear as it could be, sorry. So then I wanted to look at baseline levels of time use interaction. So participants, what I found is participants who spent more time working at time 1 benefited more from the time saving versus unconditional cash transfer condition. So you can see this is a much clearer graph, so subjective well-being at time 2. And you can see that this is hours worked. For women who worked more hours at time 1, they're experiencing greater gains in subjective well-being over the course of the study. We also saw interesting associations between time use within the time-saving condition. So within the time-saving condition, women who spent more time working experienced greater subjective well-being. They also experienced lower negative affect. Passive leisure was also associated with negative amounts of a negative association with stress, and as was working. So we saw that women who were able to translate, kind of at the point I was making earlier, women who were able to translate the free time that we purchased through these meals and laundry into work seemed to benefit most within the time-saving condition. So we see overall no effect of unconditional cash transfers or time saving in our key outcomes in our interim analysis. If anything, the planning increased stress and decreased optimism, and time saving increased stress unless women had the opportunity to spend additional time working or resting. Now, there are some limitations to this study. One slide deck one correlation table that I realized I have in another deck, but not here, is we found another really interesting pattern of results whereby women in the control condition experienced that doing leisure activities was experienced with negative subjective well-being, but In the time-saving conditions, leisure was associated with positive well-being. So we're currently exploring and following up on this idea that these time-saving services might legitimize leisure, especially among the working poor. So that was another really interesting individual difference that came out in these analysis. So limitations of the design were that there was some friction costs associated with getting meals and laundry. So women had to go to Cabarrus Town Center. So it wasn't as if, there wasn't no time cost of our time-saving condition. Also, the follow-up measures occurred about 5 to 10 days after treatment. So it's possible there was an effect of our condition that we just missed out on by doing weekly surveys as opposed to surveying on that day. And we have some text message data that we asked how people were feeling on that day that we're currently analyzing that might speak to the importance of this immediate measurement point. And also it's a relatively small time-saving amount for the chronically stressed population. So I'm currently working looking at larger and more sustained time-saving forms of aid. We were constrained by the amount of money that we had to run the study. It's quite a logistically complex study, but now we are working with a nonprofit organization. So we're looking at the long-term effects of rainwater collection technology that saves girls and women about 7 to 10 hours a day in collaboration with an NGO that I'm working with in Rajasthan. So we're studying intra-household effects. Again, we see that planning appeared to undermine well-being, but it might be possible that household support is really important for unlocking the happiness benefits of spending time. And we're currently conducting our analyses with our full sample now. So that is all the kind of results, and these are just like all the people who helped us make the study possible. And now I want to open it up for questions for the last 15 minutes or so. I don't know if I'm supposed to moderate or not, so I guess I can do that. So I guess I'm moderating. If you have questions, you could just put them in the Zoom webinar chat. So the first question from Shivani is, were there any Kenyan cultural specific aspects that could have influenced the outcomes? I think this is a really important question. I'm so sorry, I just wanna, whatever, that's fine. So I think it's really important to think about, the cultural context in general. I think that, this sample was an urban sample. They're working in the city. They had family in villages. They're kind of struggling to make ends meet. So there were some things about the sample that made it especially beneficial for us, like in terms of our conceptual design. But in terms of Kenyan specific aspects that could have influenced the outcomes, I do think that in this context, women are especially likely to be doing all of the housework and working outside of the home. So they tend to be like the primary, like in a lot of cases, they're the primary breadwinner and so on. So I think, that could be one specific element that's interesting here that we need to explore. We also saw, a high degree of single parent homes where these women were widowed. I think it's a highly chronically stressed sample. So I knew this going into the project, but when I'm looking at the data and then analyzing it, I see this very high level of things like death in families happening like on a week-to-week basis. And when you're thinking about trying to move well-being in a very chronically stressed sample, I think I would have leaned more heavily. I mean, it's ideal for running intervention in a sense because you are not at ceiling. In some cases, when I run well-being interventions, I'm at ceiling. If I'm studying like a healthy, well-adjusted working, or a student sample, I'm at ceiling on my well-being measures. Here, it could just be that the chronic stress is making it hard to move some of the outcomes I was studying. So I think I would have invested even more in these momentary affect measures, which we have some data on and I'm currently analyzing. But I think that's another really important cultural context. So I'm getting a lot of questions now. So thank you. I'm curious whether this time aid to working mothers can be beneficial to children. So this is what I'm really interested in looking at in the project that I have ongoing in Rajasthan. So it's going to work in the backwards way here because actually both girls and women are going to be saved time in terms of not having to fetch water, which takes about 7 to 10 hours each day. But usually in those households, it's the girls that do that chore. So I'm particularly interested in whether and how the time saving that's directed mostly at the target girls spills over and either, you know, creates, like, alleviates tension in the house. Like, I'm very curious about substitution in that context, because in one case I could imagine, you know, the girls in that specific context actually getting pulled onto more of the mom's chores, and so maybe they don't actually go to school with that free time. They you know, help their mom out with their chores, and so it's not quite solving, you know, the problem of education or like the educational barrier in that context. So I think that could be particularly interesting. So though here, just for limited kind of funding reasons, like very pragmatic reasons, we weren't able to look at spillovers here. We have some initial survey data that we're still analyzing. I'm very curious to look at social spillovers in the context of Rajasthan, since we're doing household level surveys and tracking the entire household over time. Sorry, like, okay. Yeah. Is there any evidence of learning? So once you save people time, they're more likely to try and save themselves time in the future using their own money. So we're currently analyzing the M-Pesa data from the participants in our study, and that's what we're interested in seeing. So unfortunately, I don't see a lot of data. I don't see a lot of updating in North American samples. So I'm not like hugely optimistic. I think what's really challenging about time saving is we're often making these decisions in a cold state. So like, you know, a personal example is like, it's hard to imagine how time saving services take time to plan, somewhat ironically. So, you know, when you even have the thought, you're usually not in a busy enough, like you're not feeling stressed out enough that you would actually kind of want to change your consumption decision. So you're sitting on your couch on a Saturday and then you're like, nah, I don't really need that food delivery or something. I'll be able to cook this week. And then you know, Monday comes around and you're in a million Zoom meetings these days. And then you're like, oh, you forget to eat until like 8 p.m. or something. So I think there is like difficult intertemporal barriers to overcome. So potentially if you prompted people while they were experiencing a specifically busy period and then asked them if they wanted to save time, people who had already like experienced time-saving vouchers might be more amenable, but I'm not so so we'll be able to look at that in our transaction data, which I'm still currently combing through. But my sense from the US samples that I've tried to run experiments like this so far is it might not be as sticky as we might like. Have I tried to consider tying the time-saving services to provide educational opportunities? So I'm not, yeah, so I guess this is like, oh, saving time in order to go to school. So the Indian study the study in Rajasthan will be able to look at this because we're tying the educational opportunity together with the time savings. So we're providing school enrollment and looking at whether girls actually go, and we're tying that to the time savings. So I think it's very interesting to kind of prompt people or nudge people to spend that time in a specific way that might make these kinds of services feel more palatable and more engaging for specific individuals. Individualist versus collectivist norms modify the effects of increased well-being from buying back time. Yeah, so we have seen in some of our other data, it's less on individual and collectivism, although that's somewhat related. It's more on Protestant work ethic beliefs. So we have other data suggesting that under both regional and cultural norms for high Protestant work ethics, so the sense that you believe that hard work is a means to get ahead, that people are less likely to buy time and are less likely to benefit from it. So we show this with both autonomous products and just in general time-saving purchases because people are worried about other people seeing them as lazy. We're also currently following up on the results that I mentioned from this study where we see that these poor working women actually, if they're in the control conditions in our studies where I typically see a strong positive association between active leisure and subjective well-being and passive leisure like resting and relaxing and subjective well-being in a lot of my samples. I don't see that here. In the control condition, working in the control condition, even controlling for the amount of hours people work, so it's not just driven by unemployment, I see that women who engage in leisure in my control conditions are experience higher levels of depression, so self-reported, it's correlational, and higher levels of stress and lower levels of subjective well-being, and that this effect completely flips in the time-saving purchase conditions, such that women in my time-saving purchase conditions controlling for hours worked start to gain benefit from leisure. And I think that these effects together suggest that when people feel as if they can take leisure and that it's okay, that they won't be judged negatively. So in the case of these experiments, they have me to blame. They're getting this leisure time because some experimenter gave them free time, so they don't have to think about it as a personal choice they made not to work or not to take care of their kids, which might be especially an unsavory perception when you're a struggling working parent. That this legitimacy of leisure might be a really important driver, both of when people make these purchases and the emotional benefits they get from them. So we're currently writing a follow-up project on how to make this leisure and these purchases more legitimate, given that high Protestant work ethic norms that are inherent in society more broadly, but also seem to be especially strongly linked to personal concern among low-income populations, how we might be able to help people overcome some of those perceptual barriers to using these services and enjoying the time that they get as a result. Changing behaviors and habits isn't easy. Were you surprised by the decline in subjective well-being? Yeah, so this is interesting. Do I see an initial decline and then adjustment? So we did disaggregate the findings. I think one thing is, if I could run the study again, and something that would come up a lot in conversation is that maybe the benefits of time saving take time. So this is what this point is alluding to, is that it takes some time to optimize free time when our schedules change. I mean, we've probably all been feeling like this as we're starting to work, we're working from home and trying to optimize and think about how to do that and feel good about that. So I will be curious. The study I'm now running in Rajasthan is much longer in the time horizon, so it might give people more of an opportunity to update. So some of the well-being, the negative well-being effects could have been driven, one, by people just kind of feeling like I was going to take away something valuable. So again, these were end-line effects. So they could have felt like a loss toward the end of the study. Maybe they were really enjoying it. And I think once I get into the weekly data, I'll be able to see these patterns a little bit more. But it could have just been that they didn't feel like they were optimizing their time, and the optimism and control, the optimism results I presented kind of speak to this. It's like, maybe it was actually making people feel like, well, if I had more time or could do this for longer, I might actually be able to make meaningful shifts in my life, but I don't get to do that here. So if anything, it's just highlighting the things in my life I can't change. So I do think that's a really important and interesting point going forward. The only other data on this question is my dissertation job market paper, which was in the moment, how do you feel afterwards? So in trying to kind of give this out over the long run, it might take some time for people to adjust, given that it is a major change in their schedule, and perhaps we were just not able to track the benefits of this aid long enough to really see those long-lasting benefits here. Cool. Is there any other questions? I know we're a couple minutes left, but if anyone has any other questions about any parts of the study, please feel free to put them here or email me. I'm happy to chat about stuff anytime.
Ashley, I think we have a couple questions in the Q&A box.
Oh, cool. Sure. Sorry, I have 2 of these. So there's chat and Q&A, or is this? Okay. So, so Corey was asking if I had any predictions about how the outcomes would look in a sample population without paid work. Yeah, so as indicated by some of my moderation analysis, we basically found that the effects are strongest for women who are able to work more with the free time off in the sample. So it's really, again, the trade-off question. So I think right now, if I were to give people time saving, this would make them feel worse, not better. Like there'd be no chance. When people feel idle, they feel very stressed out about that idleness. And so it's really about picking a sample for whom you think this is going to be most likely to work, because it's reducing goal conflict, reducing these feelings of having too many things to do and not enough time to do them. So I do think the results would look different if people weren't working. And we're currently exploring that right now. So we're running some longitudinal follow-ups in the same sample to look at how the value of time has changed during this COVID period, and whether the value that people place on their time now and how they're spending time, how much they're scheduling time now, yields dividends in the future as people try to seek work and go back to work. Yes, I do think that so I did address this question about the fading away nature. I do think that part of why we could have seen a decrement in subjective well-being, or at least the trends indicating that at time two, is exactly because women might be seeing this as a loss. So I'll be interested to see whether or not we actually see positive uptake when the time saving is an infrastructure change, as the well project that I'm working on in Rajasthan. Sorry, one sec, this chat box is like very, one second. The magnitude of income, so the effects were not moderated by income, although my sense is there's not a lot of variability in the sample, but that's a great question. I have seen some moderation by income in my past studies, whereby lower income individuals in my nationally representative samples of Americans benefit most for the reasons I presented at the outset of this presentation. Yeah, so this question that Ania is bringing up, do people get adjusted to having more time as quickly? So one potential benefit of giving people more time is they satiated on less quickly. There's research by Cassie McGillner and Jordan Etkin that would suggest it depends what people do with this time. So if you spend the time, so say you have a house cleaner every week, and you spend that time every week doing the same thing. Because you're not allowing yourself variation in the activity you choose with the free time that you bought yourself, research would suggest that this would undermine your satisfaction over time. So you would habituate to these small changes that you're making. So it's about either doing something where you experience that same activity in a different way every time, like learning a new language is going to feel different every time you do it. So it's a learning opportunity, and fill your free time with that, or continue, or make the free time blocks more variable. I think the organizers could share my email, but I'm findable, definitely, to answer this question here. Here. And then can I talk more about the pre-registration process? I think this is an important point, and I realize we're kind of like at time, but I'm going to keep going. So for people who can stay on the line, that's great. So the pre-registration process was very interesting. I've done it once before in another context where I felt, one, the results of my RCT were important, even if the result was null. Which I feel strongly about in this case too. I didn't want to be in a position of running the study and then either showing cash and time work, but or just showing nothing and no one caring or whatever. It was a big project. I'm a junior faculty member. I was like, if I'm going to do this, I need to try to, get this accepted before the results are known, because I don't want the whole project to be predicated on results looking a certain way. The pre-registration process was interesting. So we went through 4 rounds at Nature Human Behavior at stage 1. So it's very important to make sure you leave yourself enough time. Also, our conditions got quite significantly changed as a result of the peer review process, which I was fine with because I was still able to test my main conceptual questions of interest. But you have to be open to the fact that your study design may change as a function of the peer review process, and actually to engage in a pre-registered report process, you have to kind of let it change and go for it. So originally we had very specific conditions where, we were actually testing very incrementally the difference between we had constructed basically Uber Eats for this informal settlement, where we were having meal and laundry delivered to our participants, so they didn't have to incur any of the friction cost. And that was one of our treatment arms, is sort of like the inclusion or exclusion of friction. And that got cut out of our design. So we went way simpler. The Bayesian criteria here is very strict. So we have to show basically tight zeros or a very precise treatment effect. And we have to get to the statistical power necessary to show those effects. So as a result of that, our study design got much simpler. The planning the planning condition isn't in our pre-registered report. So we retain that for our own interest. And we got permission from a few other journals that if we were to find interesting treatment effects between planning and no planning, that we could go ahead and kind of, like, we got some editors' word that they would accept a submission from us, even if one condition was published elsewhere. So that's something else we did. But I do think, and I'm happy to talk offline if people have more questions, I think it's very important. I really hope more journals start doing it. I know for me as a junior faculty member, I felt like I could really take on an ambitious project like this and test questions that I thought were interesting and just find out the answers as opposed to results going in any one specific way. And I really hope more journals follow suit. But I will note it really does extend the process. So you have to be ready to wait for the peer review and to go through the entire peer review process. Like upfront, it took a long time and delayed us a little bit. So you just have to be a little bit ready and prepared for that. My unique experience on the development of field sites. So I kind of get asked sometimes, like, why Kenya? And it was a little bit pragmatic. So I had a collaborator in Kenya, Colin West, my collaborator on this project, worked at BUSAR before I went to grad school. And so we had connections there, and they were able to provide the lab infrastructure. I really wanted to road test this idea for my dissertation in a policy relevant context. It was too expensive for me to do in the US as a first year faculty member. And so for very pragmatic reasons, we decided to start working with BUSAR because I had a lab infrastructure and many years of experience with very talented researchers. And a sample that we wanted, a working adult sample who's struggling to make ends meet, and we're also time poor. So it fit perfectly conceptually with what we're interested in doing. But like I said, we did pilot for 2 years before we ran and launched and scaled our project this year, because we didn't want to go in with ideas that didn't make sense. We wanted our materials to be vetted. We wanted to do qualitative interviews. So our first year was qualitative interviews. What's time saving? How do you think about time here? Trying to make sure that some of the constructs we were taking and importing from North American context, European context, made sense. Because otherwise, you're not going to be able to study what you want to study if you're not doing it in a way that makes sense. And then the India data collection came up sort of serendipitously. They knew I was working on this work. We were connected, and they were also thinking about and working on a similar project. And they have many years of expertise. So I think it's really important to have a team that has been on the ground and done implementation work in the field context that you want to work in, because I'm not a development economist, I'm a psychologist. I haven't worked in a field context as in depth ever really before. I've done a little cross-cultural work, but in a very loose sense of that, just studying different samples at different wealth and mostly wealthy adult samples. So I'd never worked in a context like this before. So what's been really invaluable to me is to have implementation partners who really know the space, are willing to challenge my ideas and assumptions, are really willing to push me on the surveys and questions and ideas I'm bringing to the table. And that's been completely invaluable, these open communications of people on the ground that have a lot of trust in cultural capital in a specific place. Like, I couldn't run this project or the other project without that. I will note that these projects have been affected by COVID. And the very first thing we did is just make sure to put people's safety first. We paused both projects immediately. We actually transitioned some of our projects. So having alternative ways of communicating with these populations really helpful. So we didn't just rely on doing lab. We did some of our end lines over the phone, and that's been really helpful, and over text. So we're actually starting a new project. Again, we're trying to get people work in this community. Cabera has been really hard hit with, I've been, really sad to follow on the news about what's happening in that community. So we're trying to provide work opportunities via research projects for them right now, and kind of shift more to remote work for now in these contexts. So I think, I think that answers most of the questions, I feel like. Let's see. Maja, do you see any questions I missed?
I think we're all Good, Professor Whillans, thank you so much for your time today.
Yeah, thank you so much for all these great questions and for engaging so deeply in the work. I really appreciate it. And I hope you are all well. And thank you again for having me.
Thank you so much. And the recording will be available if anyone wants to review. We'll inform you more about that at a later time.
Okay, great. Thank you, everyone.
Thank you.
Bye.